Next on the agenda, ladies and gentlemen, is the address by the chief guest this evening, Dr. Anil Jasinghe. I would like to invite the president of the college, Dr. Niranjan Dissanayake, to introduce him to this esteemed audience.
It is indeed a pleasure to invite you, sir, and to welcome you and to introduce you to this august audience. And I know that you really don't need an introduction. Dr. Anil Jasinghe is a visionary leader with a distinguished career in healthcare and environmental stewardship, who significantly contributed to Sri Lanka's development and global advocacy. Currently, he serves as the Secretary to the Ministry of Health and Mass Media. Prior to this, he was a Senior Additional Secretary and the Chief Executive Officer of Sri Lanka's Climate Change Office at Presidential Secretariat. From 2020 to 2023, as Secretary of the Ministry of Environment, Dr. Jasinghe achieved major milestones, including amending the National Environment Act, formulating the National Environment Policy, and implementing the National Environment Action Plan 2022 to 2030. His advocacy for sustainability led to Sri Lanka's endorsement of the Sustainable Nitrogen Management Resolution at the 2022 UN Environmental Assembly. He also played a key role as Vice President of the Global Green Growth Institute and chaired the Asia Pacific Environment Authorities Forum in 2020 to 2023, fostering collaboration across 41 nations. Dr. Jasinghe is a proud alumnus of Mahinda College, Galle, as well as Ananda College, Colombo. After graduating from Lvov State Medical Institute in former USSR, he began his medical career in Sri Lanka in 1990 as the head of accident and orthopedic service at the National Hospital of Sri Lanka. He modernized trauma management, another significant cause of unnecessary deaths in Sri Lanka, where we lose a large amount of people due to road traffic accidents, and managing during the Civil War, and pioneered the establishment of the Trauma Secretariat and introduced the trauma system management. As the Director General of Health Services, I was indeed fortunate to work with him during his tenure. And we had two catastrophic events, 2004 tsunami and the Civil War, and especially during the COVID pandemic. He was instrumental in managing the initial outbreak and preventing Sri Lanka becoming a country with increased amount of deaths. And I myself, together with my colleagues from pulmonology and medicine, as well as other specialties, had first-hand experiences of how he approached this relentless problem. And it is indeed a pleasure and an honor, sir, to invite you to deliver the chief guest address. Thank you.
Thank you, Dr. Dissanayake, for those words. Good evening. Guest of honor, Dr. Asila Gunawardana, DG Health. Guest of honors, Professor Anita Simmons and Professor Khan. Special guests, Dr. Subhaka Kandi. Orator tonight, Professor David Denning. Dr. Niranjan Dissanayake, the President of the College of Pulmonologists. Professor Madhegedara. Others in the dais. Past presidents, office bearers, council members, officials, representatives of all colleges and academia, distinguished invitees, ladies and gentlemen. It is indeed a pleasure for me to be with you at the 15th annual academic sessions of Sri Lanka College of Pulmonologists. Thank you for inviting. I sincerely thank President and the Council for inviting me. and also organizing, bringing together leading experts of the region for these academic sessions. Pulmonary diseases remain a major public health challenge in Sri Lanka, contributing to morbidity, mortality, and economic burden. The statistics speak themselves. Chronic respiratory diseases are among the top 10 causes of death in Sri Lanka. COPD is the fifth leading cause of hospital deaths and globally the third leading cause of death. Asthma affects approximately 15% of Sri Lankan children and about 10% of adults. TB remains a concern with an incidence rate of 45 per 100,000 population. Lung cancer cases are rising with over 2,000 new cases diagnosed annually. So these figures highlight the urgent need for a strong, integrated response. Let me draw your attention to nexus between environment health and respiratory health. The triple planetary crisis, the three major issues the world is facing, is a serious concern. And unless we remedy, unless we mitigate these three crises, the living being will meet Waterloo at a time that we don't know. So therefore, it's very important to draw attention to this. And then when it comes to determinants of disease, of course, major determinants are classified as environmental and genetic. So when it comes to lung diseases, of course, overwhelming majority of reasons for lung diseases are environmental. And of course, lungs together with skin, GE tract, they play as first line of defense against any enemy. So, therefore, out of these three crises, the planetary crisis, namely the climate change, biodiversity loss, and air pollution, of course, they are interlinked, interconnected. But I would like to stop at air pollution, which is, of course, which about the topic about air pollution, Dr. Disanaike mentioned, and other speakers as well. And of course, there are local reasons. Dr. Disanaike referred to mainly local reasons. But in the meantime, there are regional and global reasons, which is the big picture. And those days, when somebody comes from overseas, they used to say, the Sri Lankan air is very thin, and, they like to sort of be in Sri Lanka. But if you take last 5 to 10 years, our air has become thicker. And off and on, things get worse. Seasonally, being a transboundary due to transboundary effect with the air currents. Seasonally, we used to get this bad air, and this affects lung health very badly. So therefore, air pollution is a major precipitating factor for these lung conditions. And WHO estimates that 90% of people in the world breathe bad air. And also, other than the air pollution, what about micro and nanoplastics? There'll be time where oceans will have more plastics than living being. So, but this same plastic pollutes air as well, and we breathe. And when it comes to microplastics, it causes lung conditions, and then when they break alveolar capillary defense, they get into bloodstream, and then it's like putting the car into a highway, and there are a lot of exits. So therefore, it can damage any organ in the system. So similarly, when it comes to epidemics, pandemics, we see that pandemics and epidemics, including COVID-19, they are of respiratory base. SARS, MERS, COVID, everything. So, touch wood, there won't be another pandemic coming in, but then we have to be cautious mainly on respiratory illnesses more than other illnesses when it comes to this as well. And if you talk of AMR, antimicrobial resistance, once again, it's about in vivo, in vitro contamination of antibiotics. And I believe that in respiratory diseases, we use more antibiotics than basically other illnesses. So, so there are ultimate, and then indoor air pollution is a problem. So what I wanted to say was that the respiratory issues, respiratory health is a cross-cutting issue. And I know what amount of important work that the college has been doing. And we listened to some of them from the president. And but then it is cross-cutting, and therefore I would like to invite the college to further engage with the whole of the society. Now, that's why I said I'm happy to hear, I'm happy to see that you have invited regional experts, unlike many other colleges. And I heard that you are going to set up a consortium. So in terms of, for example, transboundary effect of air pollution, it's very important that as a region, we try to take care of our air and try to mitigate air pollution. Because otherwise, it will be a never-ending story. So, and in the meantime, I would like to invite college to work with the Ministry of Environment as well, because they do some work on air pollution, prevention of air pollution, and then they report on air pollution. And there are several projects always undertaken by the Ministry of Environment and its organization called Central Environment Authority. So if you start working with them, I think there'll be better results, because we cannot work this out alone. So that's the reason. So in this context, I believe even the role of pulmonologists course would be evolving. So there is scope that the pulmonologists are a major and mainstream profession when compared to many other specialties, because of the cross-cutting nature of lung health. And to ensure that primary health to play a role in respiratory health, we must implement system-wide improvements, training and capacity building. The Ministry of Health is committed to integrating pulmonology training into family medicine and primary care training programs, strengthening primary health care infrastructure, expanding access to essential pulmonary diagnostics and medicines at primary and secondary levels, and of course enhancing referral pathways. The Sri Lanka College of Pulmonology played a crucial role in shaping the future of respiratory health in Sri Lanka. I call upon, once again, pulmonologists to actively support the primary care teams through training and mentorship. Family physicians and Ministry of Health officers to integrate respiratory care into routine primary care services. Researchers to generate local evidence on cost-effective primary care interventions in pulmonology. Policymakers to ensure that National Strategic Plan for Respiratory Health prioritizes primary care intervention. So therefore, there are a lot that we have to do at the primary health care settings. So therefore, I commend the College of Pulmonologists for your unwavering dedication to this course. And I wish all the best, and I wish the deliberations of these academic sessions to be a success. Thank you.
Thank you very much, sir, for your valuable words and for sharing your vision for Sri Lankan healthcare with us. Please accept this token of appreciation by the College of Pulmonologists.